Hi, my name is Jessica Ann Fleming, and I'm doing my career project on becoming a general surgeon. I am currently at Lake Center State College. On the softball team, I am trying to get my AA. I'm almost finished, and once I get my AA, I'm going to try and get all my nursing prereqs done to be able to go to the University of Central Florida for all my nursing stuff, and then hopefully I want to go to the United Kingdom and do my medical school there. It's far away, I know, but I wanted to do it since I was young. My mom and my whole family like to travel, so they say it's really pretty and they would like to go. So now I'm going to talk about becoming a general surgeon. The education requirements to become a general surgeon, or usually any surgeon or doctor, you have to graduate high school, obviously, get your diploma there. Then you go to college. You graduate college with your associate degree and your bachelor's degree in biology. That's what I'm doing, biology right now. And then you have to go to medical school. It's difficult going to medical school. There's a bunch of places that you can go to medical school at. Different places require different like things to get in. And then after you graduate medical school, you have to go and do your residency somewhere. Like me, I'm wanting to go to do my residency at Johns Hopkins in Baltimore, Maryland. It's very pretty there, and I actually just went on a visit there to go check it out, and it's really awesome, and I loved it. You have to have 5 or more years doing that, and once you do that, you have to get board certified, and once you get board certified, you can go practically anywhere that you apply to. Some require different residency, different years. Some require more than 5, some require just 5. So that's what I want to do. Job outlooks. Employment of surgeons is likely to grow 14% from 2014 to 2024. That's 14% is a lot. These percent grows faster than any other occupations. So it's general surgeon, like orthopedic, neonatal, all of that is in that percent growth than many other occupations that go on in hospitals, and like teacher and stuff like that. Job growth is predicted to increase demand for healthcare services. I was just reading about this. It's supposed to increase actually a lot. But there's some like downfalls to it whenever it comes to like now having like not robots but like other like machines doing the jobs. I don't know if you've seen it for a while, but there's some that can do like bypass surgery and stuff like that. It's pretty cool, but we're in need of more surgeons. General surgeons usually perform various operations on the human body. It can be anything. They're taught to do mostly anything in the human body. For example, the endocrine system, gastrointestinal tract, your liver, your colon, and other major parts. When the difference is like the brain usually is not general wise, like the heart and stuff like that, that's cardiologist, or like different parts, or like moving bone, or like removing legs, arms, other limbs, that's more of orthopedic. And then neonatal is for nursing and like babies. These surgeries can be minimally invasive to very invasive. For like example, getting your gallbladder removed, that's minimally invasive, or taking a chunk of your stomach can be very invasive, or stuff like that. they're here to help people when they're injured and are in need of medical assistance. Like I said, some don't need that much care, don't need that much like surgery for it, but some are needed. Usually many people come into hospitals like Johns Hopkins, which is mainly a trauma hospital when trauma happens. The working environment, surgeons usually work in well-lighted and sterile environments when performing a surgery, meaning they have their rooms are cleaned after surgeries, before surgeries, twice before surgeries, and everything that they use is practically new, so they don't come in contact with other blood or like infections and all of that can start going on. So that's why they have to be in sterile environments, and they have to be in well-lighted places so they can actually see. Some surgeons have the light that goes on their head so they can actually like see closer up and stuff like that. Many surgeons often stand for a very long time. There can be surgeries that last 5 minutes, or not 5 minutes, like 2 hours, that some can last for like almost 10, 11 hours. And they normally don't take breaks. They stand for that long, and that's very hard to do. They work long hours. Like I said, they stand for long periods of time, in irregular hours. So some doctors are on call, some don't know when they're coming in. So it's unexpected. No one really knows. Work in hospitals or surgeon outpatient centers. So some can work in trauma areas, some just work in regular hospitals. The trauma ones actually are really cool to me. Some fun facts about general surgeons. Surgery was actually practiced as early as the 1600 BC, which is a long time ago. That's longer than I would expected surgery was practiced. Some with tools like rocks and stuff like that. They don't have like the anesthesia, like stuff like that now, like they did nowadays. And to me, that's really awesome. Surgeons are usually taller and better looking than the average doctor, which I thought was kind of a cool fact, because you would have never known that. If all my Grey's Anatomy fans out there, we know that there's almost all of them are usually taller and better looking than most, like the nurses and stuff like that. It's kind of funny, but I would have never known that. Medical errors are one of the most largest leading causes of death in the U.S. There's like smoking, there's heart attacks, car accidents, but it's like not cool, but it's weird to think that medical errors is one up there. It's one of the largest leading causes of death. That's what makes me want to do it, because I want to lower that. I want to help lower that. And surgeons interrupt their patients every 14 seconds, and I thought that was kind of funny, because surgeons, I guess, talk a lot about what's happening with the surgery, and all their patients are worried about what's happening with their loved ones. So the surgeons have to be confident, and they have to tell the patient what's going on, so they have to like interrupt them and be aware what's happening. This is my Work Excited page. Interesting facts, surgery salary, the statistics, and American Board of Surgery.